We have 2 new cases to report today, and Professor Spurrier will be going through the details of those 2 cases. As I said, we are concerned about seeding, we are concerned about community transmission, and we are absolutely focused 100% on keeping ahead of the game. That's what we've done in South Australia since day one. We've stayed ahead of the game in terms of our testing regime, in terms of our quarantine regime, in terms of our borders in South Australia, in terms of our education in South Australia, and that's precisely what we'll do. We still have the highest level compliance of any jurisdiction in the country, and I thank the people of South Australia for that. And today I will be announcing some further restrictions in South Australia, and we expect a very high level of compliance with these new restrictions. As of midnight tomorrow night, we will be reducing the number of people who can be at home gatherings from 50 down to 10. In addition to that, as of midnight tomorrow night, we will be moving to restrict the consumption in licensed premises from the current regime to only have seated consumption. Whether that be with food or without food, seated consumption is the only model available going forward. I also need to make it very clear that because we are on high alert here in Australia and high alert here in South Australia, are looking very closely at the moment at the density arrangements for our licensed venues. We don't have anything to announce today, but we are going to be looking at this very carefully. We're also going to be looking very carefully at the numbers who attend our football matches in South Australia, and finally fitness studios. It is very important that we act swiftly, we listen to the expert advice, and that we stay in front of the game here in South Australia. Every single thing that we do is done to keep the people of South Australia safe during this coronavirus pandemic. Our biggest, I suppose, concern at the moment is with regards to community transmission. We've seen this in other jurisdictions in Australia. It's been absent for South Australia for a long period of time, and we don't want it to come here. We also need to make it very clear that we do not want to see the types of lockdowns that are occurring now in Victoria returning to South Australia. This would be absolutely devastating to every business, absolutely devastating to every single person's quality of life. So we're going to do everything we can to stay in front of the game, and we're sending a strong message today that by working together, we can keep South Australia absolutely safe. I'm now going to pass over to Professor Nicholas Spurrier to provide the daily update.
Thank you, Premier. So my team had a very busy weekend, unfortunately, and we do have 2 new cases for South Australia. So that brings a total of 8 active cases for our state and a total of 455 cases. So I'll give you a little bit of detail about these 2 cases. So the first is a male in his 50s. He is known to be a close contact of one of our previous cases. It was the woman in her 20s who was announced yesterday. And so we are now testing close contacts of all cases as soon as they're identified. And that means that we're picking up some of those positives in those close contacts even more quickly. Now, this man had been advised by CDCB to quarantine, which is great, and he had his test done on Saturday, and then we got the result back late yesterday. This person does have some respiratory symptoms, but is generally pretty well, but to be absolutely on the safe side, he has been isolated in a Medi hotel. And that particular person has one close contact who will be tested and then isolated, well, obviously isolated, but is also being tested. Now, that particular group of cases, which had the origins from Victoria, but we've now seen a number of people now positive, we will be calling that a cluster. The other case is of perhaps not such a concern to me, is a male, again in his 50s, who is in one of our quarantine hotels and was on one of the repatriation flights. So that was the repatriation flight from New Delhi that came in on Saturday, the 1st of August. He was tested on the same day. Again, our nursing staff have been very busy over the weekend with lots of testing, and SA Pathology have done a quick turnaround time, and we had that positive late yesterday afternoon. He does have some respiratory symptoms. He was travelling by himself, which is great, and he's quarantining by himself in the Medi Hotel. So we don't expect to have any more cases from that particular case. So this is obviously quite disappointing for South Australians, starting to have this number go up. We had one case every couple of days, but we are now seeing a few more cases, and this absolutely reflects the situation in Victoria. We have extremely tight border restrictions, particularly those that came in on Tuesday last week, but this is a reflection of how transmissible this virus is and how quickly it is spread. So over the weekend, I spoke to our team, and not only were they contacting close contacts, but they were also contacting close contacts of those contacts. And the reason for that is to try and put as much protection around those cases as we possibly can to protect the South Australian public. And it's also included, obviously, testing all of those people that are in quarantine because they're deemed close contacts. People will also be aware that we needed to make some school closures because one of our cases had attended 2 educational facilities. We reviewed that yesterday afternoon, and I spoke at previous press conference about one of those educational facilities. But again, I sat down with the team, and being highly precautionary, we decided to call the potential transmission period for that particular case, not just the 2 days before symptoms, but 3 days before symptoms. And that was the reason for including that second educational facility. So again, not a high risk of transmission, very, very small risk, but it's an indication that I am being extremely cautious at the moment in terms of making sure that we are stopping any transmission at the moment in our state. So deep cleaning is currently underway, as I understand, from the Education Department. We've already been able to contact all of those close contacts in the school community, and they will be tested. But in addition, we are likely to have a pop-up facility to do additional testing at the school once the school's open, and that's likely to be tomorrow for both of those. So, of course, if you happen to be part of that school community but not considered a close contact and you're worried, I do urge you to go and get tested, particularly if you have any respiratory symptoms at all. In total, we now have 95 close contacts being monitored by my team in CDCB on a daily basis in terms of symptoms. So whilst we do have an initial test done on all of those close contacts, and even if it is negative, we will be following those people carefully for those 14 days to make sure if they do develop any symptoms, they get tested again.